I hope you enjoyed and are motivated by our last speaker. I'm Brandis Wallace with the Michigan Health Council. I'm in Detroit today near Eastern Market. Every year, artists converge in Detroit to participate in murals in the market. There are dozens of murals around the city, just like this one. Many have a social message, like this one, but all of them are beautiful and reflect the vibrancy of Detroit. Let's introduce our final speaker, Dr. Jade Burns. Dr. Burns has been leading community-centered research in Detroit as part of a dynamic project to improve health education, access, and outcomes for young Black men in urban communities. Her project is Young Men's Health Matters. Please welcome Dr. Jade Burns.
Hello all, my name is Dr. Jade Burns and I'm an assistant professor here at the University of Michigan School of Nursing. My research broadly uses technology, for example, social media, mobile apps, messaging, and any virtual space to increase access to healthcare and sexual health services for adolescents and young adults, more specifically youth of color and young Black males. I have worked in urban settings such as the city of Detroit for over 15 years, serving youth in multiple capacities, which is community, academic, and clinical. My area of expertise in clinical practice as a nurse practitioner, a pediatric nurse practitioner, is adolescent healthcare, family planning, health promotion, and HIV/STI prevention. However, for the last decade, I have collaborated with an awesome community partner, Detroit Community Health Connection, which has allowed me to intersect my research, clinical practice, and actually see firsthand what people face in terms of health and healthcare in urban settings. Today, as a speaker, I am grateful to share my thoughts and experiences about working in community spaces, improving health equity, particularly for communities of color, health disparities, and so much more. I am honored to be at this conference and on the roster with a host of experts to contribute to the discussion today about achieving health equity through growth, innovation, and reflection. I would like to thank the staff and conference planners at the Michigan Health Council and Michigan Center for Nursing, my funders, which are the Detroit Urban Research Center, Institute for Research on Women and Gender, the Ginsberg Center, the University of Michigan School of Nursing, and of course, my community partner, including Detroit Community Health Connection, who has 7 health centers all over Detroit. They are a nonprofit, community-based primary care organization committed to providing accessible, affordable, and quality services to all members of the community we serve. So that's me. So let's now get our CEUs on and get our credit here so we can learn about the community, what it takes to work in those spaces, how nursing can impact the community and play such an important role. And I thank you for joining me today. So I'm going to now share my screen with you. So my presentation is Building Community Academic Partners, the Young Men's Health Matters program. I specifically was asked to talk about this program. I have several programs, but this is the one that is just been ongoing and has had much success. In the my left-hand corner, my Twitter and my Instagram handles are up there if you wanna follow me, I'll follow you back, and we shall begin. So who am I? So I told you a little bit who I am in the beginning, but I just wanted to mention a few points. I'm a researcher, clinician, consultant, community and pediatric expert. I am a mother, wife, and I'm a lover of social media, pop culture, sports. I like to run, travel, and spend time outside. So that is some of my staff there. We always go out to eat and have a good time after our research projects. And then below that is the School of Nursing, which is located in Ann Arbor. That's the new building. And so I have a lab and it's called the DRB lab. So the learning objectives today are in line with what you have registered for, which includes you will learn to self-report and increase knowledge on the goals of nursing profession with respect to health equity. Learn at least 2 ways for nurses to apply their knowledge to positively impact those in health disparities. And I kind of tweaked the last one. So learners will provide at least 2 learning points related to maintaining, sustaining, and evaluating community-based partnerships, and will identify ways partnerships can influence practice and the nursing profession. So today I'm talking about how important it is to not just be in an academic or medical setting, like a big hospital, but how do we relate to the community and how do we establish those relationships? So my area, as I stated before, is on adolescent and young adult health. And so I wanted to give you some brief statistics or just brief topics that really impact this population's health. And this is from the World Health Organization. So this is worldwide. And so we've seen a lot of these things increase because of the COVID-19 pandemic. But we know that injuries, violence, self-harm, and maternal conditions are the leading cause of death among adolescents and young adults. Half of all mental health disorders in adulthood start by age 14, but most are untreated, or most cases are undetected and untreated. The main issues for adolescents and young adult health include unintentional injuries, which is number one, interpersonal violence, mental health when we look at depression, alcohol and drug use, tobacco use, HIV and AIDS, other infectious diseases such as vaccination. We look at HPV, the human papillomavirus, early pregnancy, nutrition, obesity, lack of physical activity, and the overall rights for adolescents. And so I've worked with many groups of young people. My favorite job was when I was director of a teen clinic in downtown Detroit. And so we service all types of youth, which included homeless youth, LGBTQ plus youth, just the general community of high school students and middle school students. And we had such a good time. And I noticed one of the things that when I was not only a clinician, but also in an administrative role, that there were a lot of young folks, including young Black men or males, who didn't receive the services that they needed. And so they were always low in terms of encounters and billing. And those folks who would just come in, usually just for a pre-employment physical or a sports physical. And so one of the things that we noticed in the data was that there were a lot of things that impacted this group overall. So my area is sexual health. And so, this is not limited to sexual health. This includes job, employment, economic opportunities, and sexual reproductive health, just access to care, to overall care, and really trying to market toward this population. So in the United States, we see that there's a substantially greater need for sexual reproductive health services for this population, and they are at higher risk of contracting sexually transmitted infections or STIs than other young adult populations. The sexual reproductive health needs of this population are often under-addressed and insufficiently understood in clinical settings. And there are significant gaps in access to STI testing, screening, and sexual reproductive health care for hard-to-reach populations, including young Black males. Overall, young Black men carry a disproportionate STI burden, with the rates of syphilis, which is 4.7 greater, gonorrhea, which is 6.5 times greater, and chlamydia, which is 7.5 times greater, higher than their white peers. The existing literature on this particular topic of sexual health and access to care has really focused more on women's health or men who have sex with men due to increased exposure and health costs. However, fewer programs have met the needs of this population, specifically heterosexual Black men, or males, excuse me. So what's the urgency? So why do we want to address this problem? So this problem, again, there's a greater need for it. The studies show that the decisions are different in terms of why this population wants to seek out care, which include there may be a stigma, cost associated with it. There may be a lack of health insurance. People may not feel they're receiving the confidentiality or confidential services that they need, rapport with providers, clinic wait times, and then just getting a test, like getting the results of a test. But when we look at Michigan, specifically Detroit and Wayne County, we know that in 2019, Wayne County alone had more cases of chlamydia and gonorrhea than any other city or county in Michigan, with nearly 15,000 new cases and more than 200 new HIV cases that were reported to the Detroit Public Health Department. And men ages 20 to 24 had the highest rates of gonorrhea and chlamydia in this group. Across the country, Black youth ages 15 to 24 reported the highest incidence of chlamydia, and specifically rates among young Black males were reported, as I stated before, 8 to 9 times higher than their counterparts. Okay. And so where does the role of the nurse and the advanced practice registered nurse addressing health inequities come in. So as a result, nurses have a special role. So they understand the major dimensions and resources of the community. They're the most trusted provider. We know that as nurses, and that's been over the last 20 years. They also have the ability to understand how cultural and socioeconomic factors influence health and health behaviors on the patients, the family, and the community as a whole. Because of my training as a clinician at all levels, I started working out in the emergency room at Henry Ford Hospital, level 1 trauma, and then I moved to school-based, and then I became a pediatric nurse practitioner. I felt that I personally just saw things from just multiple ways in terms of how to serve patients from the families, what they had to say, the urgency. And I know that firsthand in my values as a nurse, which include the 5 core values of human dignity, integrity, autonomy, altruism, and social justice live in me. And patients and families and the communities always come first. This shined through both my research and clinical practice. And like I said, I couldn't be just a researcher without being a clinician. I'm still in the clinic heavily. I do all my research there. I practice, during the summertime. And it's just what I see on the ground is just different when I'm, in a university setting, and it's real, and it keeps me grounded both in these spaces. So with all that I had obtained with the knowledge, with working in these settings, specifically the adolescent health settings, and then when I finished my PhD, I told the CEO that I was coming back. I was coming back to look at some of the things that I noticed as a clinician and as an administrator, and if they would allow me to come back to work with that partner, that community health center, I was going to try to establish a program that really impacted the community. And I know that that's broad to say, and I know it's hard to say sometimes, but I was really devoted to coming back and returning to the city. Now, I'm not from Detroit. I'm from the burbs, from the suburbs of Michigan, Rochester Hills. But all of my family is from Detroit. And my mother-in-law, my father-in-law, they're from Detroit. And I was taught with these values, no matter where I am, the ability to serve must go unnoticed. And so I knew that when I finished, I was coming back. And that's exactly what I did. I came back and I had a meeting, and I'm going to, show you how those things developed. But the first thing with the Young Men's Health Matters program is that we wanted to establish a community academic partnership. And that was with this U of M School of Nursing. We wanted to build connections with a larger network of support and form a community advisory board to provide a fresh perspective on this population's health. And we wanted to develop an academic community plan for improving the well-being of young Black men. So we wanted to identify pressing health issues, define, if research was worth it, to develop the research questions. And we wanted to make sure that we had sustainability. Additionally, we use the principles of community-based participatory research, and we wanted to improve community engagement. We wanted to build trust, and we wanted to make sure that these programs were tailored for young men. And what that meant tailored, I wasn't the person that was coming in. I have young men and other groups of young men that I work with, and those are the folks who were talking to the community. Those are the folks who were providing ideas and helping to roll out the programs and facilitating all of this. And to know that, you have to work in the community. And so if you don't know what community-based participatory research is, at the University of Michigan, it's huge, and it's something that's used all over this country. We were quoting from Ricardo Guzman, who's the former CEO of the CHAS Clinic in downtown Detroit, and Dr. Barbara Israel, who is who has a ton of books and is just great. Everyone knows her name in terms of CBPR. And so what that means is that you wanted to establish a partnership approach to research, which means equitably involves all partners in all aspects of the research process. So I couldn't just come down there and say, let's do this. I had to see if this was something that was of interest, or even an issue within that space. And so I had to revisit that process. And then you want to enable all partners to contribute their expertise with a shared responsibility and ownership. You want to enhance understanding of a given phenomenon and integrate the knowledge gained with interventions. So I'm going to talk about phase one, the needs assessment. And needs assessments are really important no matter where you go in terms of the community, whether it's in a school setting, whether it's in a public health department, whether it's in what I am at a federally qualified health center. And so we did a needs assessment, and it's required by, in this particular organization, nonprofit organization, it was required by their grant funding. And it's overall required for their organization and other places. So it provides a snapshot of the current health issues and existing resources available in a given space. And it helps enact policy change, system change, and environmental change. It gathers culturally relevant responses, which help direct appropriate resources to targeted populations. And it tailors health services to a specific population. And last, the trust factor is most important. And so we were able to do this, and we had nursing students and public health students and graduate students. We took what they had, and we made an existing needs assessment packet for them. We used the University of Kansas toolkit, and there were some other resources that we used, and we found, we interviewed over, I think I mentioned it, 50 people, staff, and leadership about these resources and gaps and assets. And we published it in a paper. It's in Health Equity, if you would like to read it. And so it's something that they can use now. They have to do it every 3 years, that they can continue to use and update as they move forward with when they get evaluated by their grant services. So the second phase after the needs assessment, so we looked at the assessment, we found that there were several things that they needed to look at, which included like diabetes, it looked at hypertension, it looked at adolescent health. And within adolescent health, we did a more specific assessment, and we found that LGBTQIA populations, young men, were affected by care. And so that was my place, overall adolescence, but mental health was number 1, obesity was number 2, and sexual health was number 3. So it kind of it all came together. It was like a double check box in terms of what we were trying to achieve. And so it gave us the data that we needed. So the second part is that we were building the community partnerships here. And we needed to know who were the key stakeholders. So we had, when we developed this, I worked with the director of outreach. So again, you can't do this alone. You need, like I worked with the health center director who was a nurse, and the director of outreach who worked on like a lot of the marketing and communications and insurance enrollment and those type of things for the organization. Those were the people that were my voice to actually get the message out in terms of pulling in the stakeholders. And so we had a myriad of people express interest. We met both on the east and west sides of Detroit to accommodate location and needs of the members. And the discussions were completely open. The facilitators were young Black males also. I would make a quick introduction, and then I would have them take over, and they would just talk about, what the goals were. And so you see a graph here of how many students, or excuse me, how many participants, came to show up. And so we have people from job training, areas of job training, healthcare, gender and health, education, public health, sports and youth. And we have 52 members who actively engaged via email if they couldn't make it. And then we had about 15 people come in with each session. And we had 3 meetings, as I stated before. And again, people just opened up. It was just very therapeutic. And I was just like a fly on the wall. I just would stand in the corner and watch all this happen. And it was just beautiful in terms of having people, express their feelings and knowing that someone was going to take the information and do something with it, not just listen. So again, with the data, You see the most pressing issues, which include socioeconomic factors, behavioral health and substance abuse, lack of education, violence, and health issues. And so the slide or the picture to the right, we would poll the participants and ask them, you know, what do you like this particular, what do you believe is a health issue? And as you can see here, it's mental health, and everything that they thought about mental health, excuse me. With the scope of this partnership, the patient and community advisory boards are in general a new strategy. They're different from governing boards, which that is what for nonprofits, they have to have people, the users of the clinics, and they look at the CEO and other leadership to see what they're doing. Then you have patients who join or the communities that join, and these advisory boards are endorsed by such agencies as HRSA and are listed as a component for patient-centered medical home certification and Medicare and Medicaid reimbursements. And the rationale for the creation of these boards is historic, as these boards allow the opportunity for shared governance and for health services to be, again, tailored. The word tailored is so key to the community's needs. So then COVID hit. So at the end of these 3 discussions, these forums, we had all this information. And the next step was to create a huge conference in which it was a TED Talk style. You know, and so during the height of COVID, there was the pandemic, and in 2020, we say a double pandemic for not only just the virus itself, but for civil unrest. So we had to figure out a plan, you know, as I said before, we were going to have this big conference with TED Talks and community experts on all 5 of these areas. And then we were going to survey these individuals to see what we could do more. We couldn't do it. It was impossible. And we were looking at February, started planning. We had the space, and then March happened, and it was just very bleak. And so what we ended up doing, we used virtual spaces to reach hundreds of Black males online. And we did that by engaging key leaders who represented their demographic across the state of Michigan to engage them on various health topics, as well as identify the key priorities for this community. So these topics included poor access to mental health, the stigmas that prevent young Black men from seeking healthcare support, barriers to STEM education in Black communities, COVID-19 exposure and information, and the risk behaviors that contribute to adverse physical and mental health outcomes for Black males. This experience provided a valuable opportunity to participate in the community engagement, and we surveyed over 400 men, or actually surveyed almost 500 individuals through these events, and it ended up being almost 300 men who took the survey, and it led to tangible findings for health and wellness of urban communities and this population, and it provided me also with preliminary data on risk behaviors. And so phase 3, this is the city of Detroit. This is from the Canada side. The program starts. And I'm just going to give you a few images and tell you about the programs that we made. And these were all virtual programs that reached tons of men. And we had newsletters and email blasts, and you know, and then we measured all the metrics. And so again, that's another part of my area with like social media. So we would craft or we would create different links to show how many people engaged in, like, whether, you know, registered via LinkedIn or Twitter or Instagram or email or word of mouth and Facebook. And so we looked at how people engaged in terms of getting the word out. And so here were the first 2 events. And so the Black Men's Health Summit, what happened was we ended up turning the conference into a men's health summit. We opened it for all. And we put it in May, and it was right before the George Floyd events. And so we didn't know what was going on, but we had a ton of people. We had like almost 300 people register in like 3 days. And so, you know, we just didn't understand like what was, you know, like we understood what was going on, but we didn't see that there was a connection, but it was. So it was a space for folks to talk. So on June 6th of last year, we had an engaging panel of speakers that included the Lieutenant Governor, Garland Gilchrist, detailing the state's COVID-19 response efforts and the development of the Michigan Racial and Health Disparities Task Force. At the time, we had the Detroit Police Chief, James Craig, who shared his perspectives on protests against police brutality and the larger impact of violence on men's health. And the other speakers covered topics including access to mental health services and the stigmas that prevent Black men from seeking support and barriers to STEM education in Black communities and the risk behaviors that contribute to adverse health outcomes for Black males. And so that was open to all. The average age was probably about like 34 or 35. And then we, again, we had to, tailor it again. So we came up with something called Real Talk. And Real Talk was the second event, and that was on June 23rd of last year. And it shifted the focus to a younger audience in a more conversational format. And we dialogued about health, wellness, and success for young Black men and brought together a physician. We brought together a physician, counselor, community activist, professional musician, and even a former quarterback from the University of Michigan to share valuable perspectives with parents and young adults in a digital space. The panel of current and former Detroiters tackled a wide range of topics, including mental and emotional health and how to address issues of systemic racism, the importance of the arts, health disparities, and a lot more. And the panel also took questions from attendees throughout this hour-long webinar, and it was rich. It was really, really rich in terms of the base, the community they were talking to. And we had probably with both of these formats, so the men's health, we had about 1,000 people view it, and the Real Talk, we had about 2,000 people view it, and on Facebook. So on YouTube, it was not that many folks, but when you live streamed it, it was a huge success. So then these are the events through 2021. And we learned here that we had the vaccine awareness of healthcare providers for Detroiters. We had a healthier lifestyle leads to healthier heart. So Heart Awareness Month. We had colorectal cancer. We had STI Awareness Month, which this one was geared toward more young men. Fitness panel, which was geared toward young men, and 5K, which is geared toward young men and fathers. So we had a variety of events. Here's the fitness event, and we had folks, Desi Johnson too. He is a banker, and he holds an executive position at one of the banks here in Michigan, but he also has a fitness company. Armand Rashad owns Jab Gym, which is located in the Eastern Market. And Chris Huff has a gym located in Ferndale Oak Park area, and he trains a lot of athletes that include track, football, and gymnastics. Is a gymnastics training center for young folks in there. And so this was moderated also by Derek Ware, who's director of community outreach. And we also had folks from like the Curtis Center in Michigan and then to sponsor this event. And then the last event that we had was for the Men's Health Month. We wrapped it up, and we collaborated with the Detroit River Walk, and we got a path for folks to run or walk the 5K on the DeQuinder Cut. And it was hosted on Father's Day weekend. So we had young folks, and their fathers. We had people who had lost their fathers who were running in support. We had over about 100 folks participate to run and enter their, upload their images to where they could do it anywhere. We actually had people from Texas and Florida do it. We just couldn't send them out their packets. We had 3 packets that included a water bottle and like a pedometer, and like we had there was so much stuff in there, headbands and a towel, and we got a lot of people to donate, and people in a t-shirt, and people picked up their t-shirt and they walked the path, or the path that they created for themselves. And they uploaded those screenshots of how long it took. And it was really nice to see that people participated and had something to do, because it was the same week as Juneteenth, Father's Day weekend, so people could participate in both events. So the next step was the lessons learned. In all, partnerships between communities and academic entities have been critical in addressing complex issues among communities of color and hard to reach populations, such as young men. This strategy of setting up a community advisory board for the health center in partnership with the academic organization was pivotal in the successful application of grant funds. So we had grant funds that we could explore. It also created a space to explore opinions and solutions that involve the community. We found that here, I've got several things listed, that preparation is critical to carrying out these forums and discussions. This included a well-structured presentation, agenda, and prepared facilitators who represented the community. From the outset, we determined that establishing boundaries, checking on people's feelings of the group, including energy levels, interest in the subject, and whether we were hitting the purpose of the meeting each time was being fulfilled. We were also persistent in sustaining communication and keeping everyone in the loop regarding goals, decisions, deliverables by open dialogue, and emailing out post-forum notes regardless if people attended or not. So people got the information all around. I mean, we had newsletters, and again, we measured how many people looked at those newsletters. Probably we got about 50% of people who opened up the newsletter, and again, people were watching the videos that we taped. And so other aspects we included, we maintained focus given the variety of community needs. Building trust was extremely important, with location being flexible. And we also need to understand whether people could use Zoom or not. Even today, folks still have a few issues with online platforms, but it really helped us to access more people. I do think personally that I like the in-person events, because you can see people's facial expressions more, their body reactions. We got to get lunch. We had lunch, so we had food, we had community, and it was just a time for just just talking and being yourself. And so that I do miss. We don't know what's headed our way, excuse me, this fall, but we're going to take a break this fall and then start again in the beginning of 2022. Right now, I just put in a grant to look at, because we use a lot of social media metrics. We were looking at digital spaces to really do data mining, like looking at Twitter, and seeing their responses and phrases in terms of young men and the sexual health piece. One of the lessons for me personally that I learned is that, as you probably noticed, that this young men's health got opened up to all men. And a lot of the research explores that men just in general, whether they're, Black, Latino, white or whatever, just not going to their providers and getting care is just a trend among men, period. And it's not even in Healthy People 2030 to look at men. But in doing that, we learned how to market, craft and design, campaigns and measure the metrics to see which places would it promote more depending on the audience. And then I was able to take stuff out from young men. So now the complete focus is to create an overall program of content, and we're going to have people evaluate that content and create a program that can be hopefully tailored and put into places, whether it's with sports or the colleges. And it's really, my heart is a community health center. So I want to bring those folks in the door so that they can really take care of themselves. So the conclusion, the main goal of this presentation was to describe how do we develop this partnership through an urban FQHC that revolved around young Black men's health. This just didn't happen in a flash. This took time. When I was a student, as a PhD student, I saw that there could be a real relationship there, and I was devoted to the community and invested. And I felt, as a person of color, as a woman of color, as a clinician, as an educated person, as a person who, I lost my father to, colon cancer. He died at 59. I have a son, I have a husband. This is all important to me, and I love adolescence. It was a great way to combine all of my passions together. And I hope that you have learned something that you can take. It doesn't have to be young Black men's health. It could be, something like health literacy, or it could be hypertension, or it could be, food, lack of food access, and understand that you have to put the community first. You have to listen to them. You can't come in and then I'm not as important, because people, I'm a professor, but people really care. When I go down to the city, they ask me, how long have I been in the city? Who do I work with? Who's my family? They want to know what the connection is. And so you have to be connected to these folks. You can't just come in. It makes it much harder. So with that being said, here's some resources. You can get a copy of these slides. And we have different researches about National Association of School Nurses Mental Health Position Statement, the Children's Center. We have the Trails program, which is at U of M. That offers mental health services, Healthy People 2030, good old Michigan Department of Health and Human Services. There's information about the COVID-19, the coronavirus with kids. Okay, I want to thank again everybody who came to this presentation, this virtual presentation. And I would like to thank my staff again and MHC and everybody who has joined us to learn more about health equity, advancing health equity. Is my email, the Twitter, the Facebook, Instagram, website. Please connect with me. Again, I wanted to give a shout out to Salisha Barnawal, who is graduating this year and will become a future physician dealing, with marginalized populations and also the international health community. And I also want to thank the people, all the young men who participate in these events. We have publications out there. This is all being published right now. And we want it to be in places to see that the community out there is really doing good work. And I thank you for joining me. And you stay safe out there. I welcome any questions that the audience has regarding this topic in terms of developing community partnerships or just experience working in this population as a clinician or health policy or getting grants. Please ask me some questions. Thank you.